The Rundown with Carrie Saldo podcast is funded by Armbrook Village, offering research-based arts, music, fitness, and lifelong learning programs at their assisted living and Alzheimer's care community in Westfield. armbrookvillage.com.
This is The Rundown, your weekly news and review from Western Mass. Good morning, I'm Carrie Saldo. Joining me in studio this week, Mass Live State Editor Dave Eisenstatter, Matt Safransky, Editor-in-Chief at Western Mass Politics and Insight, and NEPM reporter Caitlin Reardon. Audience participation is welcome here at The Rundown. Hit us up with your questions about the topics at hand via email, therundown@nepm.org. Okay, panel, let's run it down. A rare departure for The Rundown this week. We are going to start with national news, not Western Mass news. So as many of you, all of you probably know, the two frontrunners for U.S. president met in a 9 p.m. debate last night, hosted by CNN and simulcast in all of the places, including on this very station. It was the first matchup that we saw between the sitting president and a former one. Matt, your takeaway from last night, other than, 90 minutes of my life that I would like credited back to my account.
Well, not only the 90 minutes, but the hours of, punditry thereafter is also, I want back as well, if anybody has a way to do that. Now, I think the biggest thing I learned was that, reporters are still willing to credit without, any question, anonymous statements from a party after an event like this. You've said this for years with Donald Trump. All these Republicans saying, oh, this is terrible, oh, this is bad, but don't say my name. And despite the fact that I don't think anybody thinks the Democratic Party has become quite what the Republican Party has in terms of subservience to the person who's at the top of it. So that was a major point that I saw. Overall, it's undeniable that President Biden did not accomplish what I think a lot of people wanted him to accomplish. But it's interesting. There's been a lot of focus groups that show that people who watched the whole debate came away remembering why they didn't like Donald Trump in the first place.
Yeah, well, I'm one of those coveted undecided voters, and last night did not help me a stitch. I feel like I listened to two candidates gripe and snipe for the better part of 90 minutes, and I was waiting for the passion, the plan, for leadership, something akin to any of that, and I didn't. So I was sort of like, thanks for playing, gentlemen. Be sure to grab your I was the free leader of the world tote bag on the way out, and we'll catch you next time. I do think, though, the happiest people on the planet right now are the writers' room at Saturday Night Live. I think show will probably crush it this week. All right, let's move on to Western Mass news, shall we? Namu Sunpath for The Republican this week was writing about whether bus fare should be free. A recent program in Amherst with free bus fare had positive impact for some area residents. The program there is the Fair Access Program. Quoting here, ever since Craig's Doors started purchasing bus passes from from the Pioneer Valley Transit Authority to give homeless and low-income individuals in March 2023, it's distributed over 9,000 daily passes and helped over 475 people. The results, the nonprofit said that a recent survey of those transit riders show the passes have notably improved their lives, allowing them to get jobs, attend doctor's appointments, and seek legal help. It sounds like an idea with a lot of potential upside, access to jobs, healthcare. Just two examples there. Dave, your reaction to these findings from the Craig's Door program?
Yeah, well, this is a limited program that took place in Amherst. Worcester has actually been doing a full-on program like this for multiple years now, where the bus is just free, and they just signed on to continue that for another year. So this is definitely an idea that people are excited about. There is some direction from the state level to really expand this statewide, to maybe make all of the regional transit authorities
I think
free.
The Senate has that in their budget, right, as a proposed idea.
Yeah, and I think the success that Worcester has seen, and now this more limited success that has been seen in Amherst, is definitely going to be some evidence that they're going to be looking at.
I think one of the issues, though, is always like what is going to get traded off as a result of it. You have seen in some transit authorities like, oh, it's free, but we're cutting service. Or in many cases, they need to have service expanded. So the question becomes, is it appropriate to be spending extra money? I mean, I think it's something like, tens of millions of dollars. I don't have the exact number. It's in the Senate bill for fare free transit. But wouldn't that be better in improving service and then creating other programs such as this one in Amherst, which is directed to people who are going to benefit the most from it, the kind of free access to the service that they really could benefit from.
Caitlin, you're there in Amherst as a student at UMass. What do you see as people are trying to navigate PVTA?
Yeah, so on campus, it's completely free. But unfortunately, a lot of the students will kind of complain a little bit about the PVTA system, as much as it's great and amazing that it's free, because we are so lucky that it's free and it's not for everybody else. The app can be kind of hard to navigate. There are delays. Sometimes the bus doesn't show up. My friend actually sometimes will take Ubers to class because she is late, which is dramatic. But, exactly. But at the same time, us as students, we have to remember that we're actually in a very fortunate position. And making this a fare-free initiative would really help with especially the marginalized community, with access to food, access to social services, and things like that. So hopefully they can get this initiative off the ground and running pretty soon.
NEPM's Adam Frenier had a report, I think it was last month, that pointed out that really across Western Massachusetts, whether it's Berkshire, Franklin, Pioneer Valley, bus service for this summer is essentially free. There's some caveats, and you can check out the story link on our page, therundown.org/NEPM, to Adam's story there for the intricacies of where there won't or when there won't be free service. But we'll have this chunk of the summer to take a look. But as Dave pointed out, Worcester's 5 years, now running on 5 years of having these fare-free programs. But that does not mean that running a transit authority is free. Far from it. It's tens of millions of dollars, to Matt's point. So I think it's going to be a really challenging process to weigh the two, the benefits and the harms, and how you work that out.
Just one other thing. I think the other challenge that these regional transit authorities face is that the fares themselves often don't cover the costs of running the regional transit authority as well. So, we've seen cuts to routes, I think across the state, but certainly in Western Massachusetts, even without the state level support. Yeah.
And outside of the 413, back to that Worcester point, in WBUR's Dan Guzman's story, he said that the 7 out of 10 riders support keeping the policy in place to have this fare-free system. I'd be curious to hear from the people who aren't in favor of it, their concerns, whether it's the cost or any thoughts on what you think those concerns would be, Matt.
Well, I think the problem is that on the one hand, fare-free comes from a general idea that if you have a public service, it's available to everybody. Think about Social Security. Everybody gets Social Security. Warren Buffett is eligible for Social Security, but the idea is that it will have broader political support and therefore, greater financing and backing from the government. But you also run the risk of turning something, when you make it free, of creating a public perception that it's more of a welfare program, which it may not be, but that changes perceptions about it. That can change how support is for it. Look at something like the MBTA in Boston itself. It's essential. The city wouldn't run without it, and yet it still struggles to get the kind of political support it needs. And now the number of people that use public transit basically anywhere outside of Boston is considerably lower. Imagine how they would think about it in terms of their priorities and what they're telling their legislators if they're like, oh, it's just free, it's just a handout. Now, I don't agree with that mindset. I think it's quite wrong in many ways, but that's how people are going to respond to it, and I think that can create problems for it to grow and expand and become attractive to people beyond its current user base.
Do you think that then stops up the effort by the state Senate? I found that number. It's proposed $40 million is in the state Senate budget proposed for this initiative that would make the RTAs statewide free. Do you think that concern is going to get in the way of an effort like this?
I think it explains why the House wasn't interested in it as much, and I certainly would think if you're going to take $40 million, use it to hire more drivers, improve frequency, get cleaner buses, et cetera, et cetera. If fare-free transit is something that's possible down the line, great, but it's worth noting that virtually no public transit system on Earth has done this, including many of the Eastern Bloc countries at the height of public investment in public transportation there.
Go ahead, Caitlin.
And I don't know if you mentioned this, but this year is the 50th anniversary of the PVTA's operation. So,
Thank you.
you know, going through until I believe August, transportation is free on the buses. So I think really if the time were to do it, it would be now, to get some action going, like you were saying, with just improving the facilities overall, how they're running, more drivers and things like that. So hopefully something will sort of happen quite soon.
Well, we'll keep watching it, won't we? I'm going to move us on to a story about primary care. The Greenfield Recorder reported this story by Anthony Camilleri. Bridge Primary in Greenfield poised to expand amid primary care physician shortage. That was the headline of the week that I read twice. I was like, what? What is going on here? Bridge Primary in Greenfield is eyeing an expansion, according to the Recorder, trying to raise $20,000 to match a Mass Health grant to help fund that expansion. It aims to double its provider staff from its current 5 to 10 over the next 5 years, and the expansion would allow for the treatment of 10 to 15,000 patients, they said, each year compared to the current 5 that they're currently treating. And this comes amid a local, state, and national primary care physician shortage. Reaction, Dave?
Yeah, I mean, this is a major issue, especially for a place like Greenfield. There are, I think I read at a national level, tens of thousands fewer primary care doctors than there need to be to cover everyone. And what the research has shown is that when people are long delayed to get their appointments, they just wind up not having them, going to the emergency room to take care of coverage that could just be done at a regular doctor's visit. And it's a major problem. So, this is a local solution. They're doing their best to figure out a way to keep Franklin County covered amid this national crisis.
And to your point, that statistic, the one that I read was Health Resources and Services Administration. They projected a shortage of 68,020 physicians nationwide by 2036. So obviously, a significant problem there. A few less than fun facts related to the current state of primary care. Excuse me. WBUR in March reported this out. Quoting here, this is the frustrating reality for primary care providers and patients across the state. People are waiting longer to see their doctors, often weeks or months, if they can find an appointment at all. And even as clinicians say that they're trying to help as many patients as they can. I think the WBUR story pointed out that one physician that they profiled, her hours she was working 12-hour days and responding to email and phone calls on the weekends and on her vacation just to try and keep up with her patient load and her dedication to patients there. And then just a few other facts here. The Massachusetts Health Quality Partners says that access to primary care providers has been declining for 3 straight years and remains below pre-pandemic levels. Observations from either of you, Caitlin? Go ahead.
Yeah, I think what you're seeing is burnout, especially with COVID. A lot of these appointments turned online. Obviously, most of them have gotten back to being in person, but things have definitely changed, and you've lost sort of that face-to-face interaction that is necessary for not only the patient, but the doctor and the provider. You're also losing sort of the more quality care that you would get in person. Those lasting effects, I think, are really prevalent, especially with burnout, and maybe sort of turning some providers away from everything, especially within rural areas as you see. So
also having some unintended consequences for our emergency room systems, because if you can't get in to see your primary care, you're going to the ER for non-emergent care, which is its own special type of madness and problems. Another related healthcare story this week, there was a virtual briefing on long COVID. It was the second one that State Representative Mindy Daum of Amherst held. It was held on Tuesday, and the symptoms of long COVID include shortness of breath, cognitive dysfunction, physical disability. They're all these sort of nebulous symptoms that are so nagging for the people in my life that I know are struggling with it. 15% of all Massachusetts adults have had symptoms of long COVID, and the effects of long COVID disproportionately affect people of color who already face inequities in access to care. Matt, I was thinking about that currently there's the ominous health bill that would expand coverage for state-provided mass health insurance to all those eligible regardless of immigration status. And then there's others who've called for Massachusetts to enact guaranteed paid time off like we saw during the pandemic. Do you think there's a political appetite for either of those things, though?
I think the question in terms of the expansion of eligibility for healthcare is going to depend a lot on what it often depends on, which is money. It's interesting how some of the machinations that the state has taken, or the political leaders have taken on, like the migrant housing issue, because it doesn't seem to actually be denting anybody's local political capital. But if you start taking money, away from something else, then you might start creating enemies. So it's really going to depend on how much it's going to cost and where they get the money from. If they can do it artfully without hurting anybody else's or goring anybody else's ox, then I think it might be plausible. In terms of the paid time off thing, I think we're marching in a direction where that's going to become more and more of a common thing. New England broadly is moving in a direction that mirrors, it's not quite on par, but what you see in a lot of Europe. I do just want to make one quick point about the primary care thing. One of the problems that we have in this country is that we stopped increasing the number of people that are trained as doctors proportionate to the growth of population over the last 20, 30, 40 years. And so as a result, we're ending up with a shortage because the people who were trained as doctors 50 years ago are all retiring.
Yeah.
And so there's just not enough people that are being put into place. Maybe that's something that, if Congress can't fix it because it's paid through the Centers for Medicare and Medicaid, that maybe the state wants to start, looking at as well on its own.
I'm going to take us to the break, but I also think it's going to be interesting to watch places like this Greenfield Care Center because it's a small community center, right? Look at Steward Healthcare, one of the 3 largest healthcare industries in Massachusetts, is now filed for bankruptcy. So I think it'll be very interesting to watch sort of that push-pull between these big healthcare providers and these smaller localized systems. All right, there's more ahead on the rundown. We'll talk about why Massachusetts schools are having the worst school budgeting crisis in decades, details on an important school committee vacancy filled in Holyoke, and I'll ask our panel whether Massachusetts needs a commission on journalism. Stick with us. The Rundown will be right back. Welcome back to The Rundown. I'm here in studio with Dave Eisenstatter, Matt Spransky, and Caitlin Reardon. We're going to turn to a story from you, Matt, this week. Recently, you reported that with Holyoke leaders poised to take back local control of its public schools, a vacancy on its school committee has been filled, at least on an interim basis. You reported this for your site, Western Mass Politics and Insight, and it was in a seemingly really hot seat. There were 6 people interested. Spoiler alert, Devin Sheehan was their pick, and he has a significant amount of past experience. Do you think that's what city council and school committee members were attracted to?
Absolutely. Devin has been, he was a school committee member before this takeover. He was a school committee after the takeover. He ran for mayor in part on, obviously there were some people that attacked the fact that the schools were taken over, but he also was vigorously in opposition to the takeover itself, traveling to the meeting in Fitchburg where the final vote was taken on that. And I think that kind of advocacy and that background and that continued involvement, because he continued to be involved in secondary and primary and secondary education, was very attractive. And let's be honest, everybody on the school committee that was there and most of the members of city council also knew him. I don't want to discount that as a fact, but it wasn't like it was just a same old decision either.
And you alluded to the fact that Holyoke Public Schools are currently in state receivership, which is this process by which the state deems or looks at the school records in Holyoke and deems them underperforming. And it was a very long, convoluted process. They've now been under state control for almost a decade, and we've been working our way now back to this local control process, which will be hugely important in the next weeks and months, which is why part of the reason it was important to fill this vacancy left by Erin Brunell on the school committee, who left for family reasons and sort of on short notice and unexpectedly, I think, for many folks.
Yeah, she just started a brand new 4-year term in January, which is also part of the reason why there will be a special election in 2025 for the last 2 years of this seat.
So he won, again, which is why I said interim, right?
Right, exactly.
So I know that Sheehan pointed out that there are many people who feel that the city's public education system isn't listening to them. Did he elaborate on that at all?
Not in a whole lot of detail, but I think that what you did see is that, there were a lot of innovations that came about during the pandemic. Obviously, the pandemic began after the takeover, but you certainly get the idea that the ability to hear from people, hear from leaders in different languages, for example, was a way that allowed a connection for some people. But even so, you still have a lot of parents and teachers and students and other advocates who sometimes feel like decisions are being made unilaterally. I don't know how much of that is just a symptom of the fact that these decisions are actually being made out of Malden, where the Department of Education is based, or if they are, not just literally not listening. So I think that a lot of this is also just, that process of putting the control back into a local sense, back to people who are elected in your wards and citywide, who can bring those issues directly. Because it's true that a lot of power in public schools resides in the superintendent, but as advocates, members of the school committee can bring issues directly to the superintendent with hope of a better resolution.
Absolutely. I want to turn us to other education-related news. Dave, Mass Live's Juliet Schulman Hall took a look at why Massachusetts schools are having the worst school budgeting crisis in decades. We've been talking about that here on The Rundown. You've heard it on our news channel as well. One common thread among those is the Elementary and Secondary School Emergency Relief Fund. Shorthand there is ESSER. Remind us what those are.
Yes, so this is a federal program that was developed over the course of the pandemic to infuse money into school districts that were struggling, having to do remote learning and all kinds of things. Now, the idea of this fund was always it was going to be a one-time influx. The problem was that the needs of the districts were ongoing needs. So this money was a Band-Aid. And the Band-Aid just got ripped off because all this money is due to be spent by the end of September of this year.
And it's $190 billion,
yes.
billion with a B, dollars. We're talking about huge money here.
Right. And it was very helpful for a lot of school districts across the country, but certainly here in Massachusetts to, keep the lights on and keep their staff members. Now, with the end of that money and some other factors, we just kept seeing these budget crisis stories. We cover communities across the state, and we kept seeing the same story over and over again. People talking about layoffs, some of them quite significant. In Worcester, for instance, 300 layoffs out of a staff of 5,000. So that, that's a pretty extreme case, but a very common thread. And what has compounded that is that Massachusetts tried to step in with the Student Opportunity Act, which was passed in 2019, to help these school districts get money. A problem that happened that was not foreseen is that inflation went through the roof. So there was state money that was, it was capped at a certain level, of inflation, 4.5%. What was seen was about 8% inflation, so almost double that. And statewide, to the tune of something around 260 million is what the value of the money lost over those past few years.
But given that these ESSER funds were supposed to be one time, or at least we knew they were going to sunset, Matt, isn't this a problem that was foreseeable? Use it on a one-time cost instead of recurring.
Yeah, I think that, it's, as somebody who covers more the municipal side of budgets, the non-school side of municipal budgets, I should say, you are not seeing this at the same level. There are definitely some crunches, but a lot of that tends to be related more to the revenue side, in the sense that, like, property taxes are just not coming up to snuff. It doesn't seem to be overspending per se. And I think part of that was a lot of decisions that were made from the infusions of money from both the CARES Act and the American Rescue Plan Act that were just used differently on the municipal level. It was used for a lot of one-time either capital or programmatic expenditures, as opposed to adding to the size of the overall budget, which appears to be a mistake that was made in some school budgets across the Commonwealth.
Well, we asked this to school officials, and because it does seem like a pretty glaring oversight. What they were telling us was that this was over the course of the pandemic, and there were ongoing needs that needed to be met. That they weren't talking about building a new building or a new gym or something. They were talking about dealing with mental health crises in the moment, and that's how the money was spent.
I understand that Mass Live is also reporting out on those solutions, so it'll prompt people to solutions to this problem. That story will be dropping soon, if not already today.
We've got it up this morning.
I'll prompt people to the website for that, so I can move us on to our last story.
MassLive.com.
Very quickly here. Mass lawmakers eyeing a revival of a panel to help struggling journalism industry. Reporting here by Chris Linsky of State House News Service and NEPOM's Adam Frenier. In brief, tax credits for local publishers, grant funding for news organizations, and state-covered wages were recently graduated reporters. Caitlin, that could be of interest to you, who cover underserved communities, are all on the table here as Massachusetts lawmakers consider how best to support the ailing local journalism industry. Matt, let me start with you. Founder and editor of Western Mass Politics and Insight. Barrels of cash coming in there, right?
I think that it's good that this is getting a second look because they didn't really finish their job the first time. And it really is the local areas that need all really need the coverage. I mean, as somebody who, on the municipal level, I can tell you, like, the vast majority of my attention is Springfield, Holyoke, and Longmeadow. That's probably together 90% of what my stories are in most cases, and that's just a bandwidth problem. So you can only imagine how important it would be to have more coverage of Chicopee, more coverage of Agawam, more coverage of Amherst, more coverage of any city or town. And it's good that they're revisiting this. The problem, of course, is always who gets it, and then how do you make sure that as many people as possible come across it, because it's so easy to avoid news you're just not interested in now more than ever.
Caitlin, the one thing that I highlighted before, the state-covered wages for recently graduated reporters who cover underserved communities. Thoughts on that idea?
Yeah, we need more graduates who are coming in, making it attractive for those recently graduated journalists to come in and report on these underserved communities. I will say I would love it if this commission comes into fruition, some student journalists that could give their input, because really you're seeing a lot of student journalists in my generation who are doing some really amazing on-the-ground reporting that's getting national recognition. It's getting awards. You saw it a lot with the protests on campus for Palestine. So making sure that we implement young people into this process is going to be very, very important.
Dave, do you think second time around might be a charm here for this journalism panel?
Yeah, well, you got a room full of journalists here. We don't
Journalists
have
talking
exactly
about
a balanced view here. But I think that it will be interesting to see. I think was it Paul McMurtry? He said, we'll see what's possible. It seemed like there was some passion there, but you really never know with the legislature if anything's going to get off the ground.
Yeah, well, we'll keep watching it here on the Rundown for sure. I'm going to move us on to our predictions, scoops, and praise portion of the show, where we ask our panel to do something against their very nature, spill the tea about a story they're working on, maybe make a prediction about the news, or heap some praise on a newsworthy nugget that needs to be trumpeted. Matt Safransky.
Well, I'm going to kind of do a little bit of a prediction that ended up coming true. I've been covering the legislative package that was put through to ensure the appointment of Springfield Police Superintendent Lawrence Akers. There was a whole big thing about whether or not he would be able to continue contributing and growing his pension after his 65th birthday, because there's a cap on public safety employment out at age 65. The legislature finally put out its bill, which very strangely revised the home rule petition to that effect. And surprise, they removed the city's provisions that would have allowed him to continue contributing to his pension. This is consistent with state policy, but everybody was in denial about it 4 months ago.
Caitlin Reardon.
Right now I'm just working here every Friday doing dailies, so that's on the more news side. But as for this coming year, I'm going to be the editor-in-chief at the Daily Collegian at UMass. So this summer is just a lot of prep work and a lot of planning, and making sure that we're communicating with editors and planning our initiatives and projects for next year. So that is the bulk of my workload.
Excellent. Dave Eisenstatter.
So Karen Reed trial, very big trial here in Massachusetts. Woman accused of killing her police officer boyfriend. My prediction is that the verdict is going to come today, because our 3 top people that we've had covering this are all off today.
Of course, and it's a Friday.
Yes, so that's my prediction.
That's when all the big news happens. Well, I have praise this week for Lori Stabile, who wrote in The Republican, and she's got me thinking about my own motorcycle stunt name here after I read about how Palmer native and motorcycle daredevil Doug Danger rivaled and befriended Evel Knievel there, and he'll be in Palmer speaking about his life and work and interests. So Palmer, Saturday at noon, the Palmer Library. I'm thinking Carrie Perrell. What do we think? Yeah?
I love
Maybe?
that.
Yeah.
This week's panel, my thanks to all of you, Dave Eisenstatter, Matt Safransky, and Caitlin Reardon. The Rundown theme is by The Love Crumbs. Our director is Tony Dunn. I'm Carrie Saldo. Thanks for joining us.